This first CAP is entitled Screening Assessments of Reading Skills. In this series of CAPs, the three types of reading assessments will be discussed. The three types of assessments are screening assessments, progress monitoring assessments, and diagnostic assessments. Screening assessments determine which students are struggling. Progress monitoring assessments determine if the student is benefiting from instruction and/or intervention. Diagnostic assessments determine what specific challenges a student is having and can be used to identify students for special education services. This first CAP will focus on the first, screening assessments. Phonemic awareness screening measures should be completed in PK, kindergarten, and first grade. They may also be used for students in special education in any setting and/or grade level. Research has shown that students who receive early support in phonemic awareness stay on track to become proficient readers. Evidence-based phonemic awareness assessments include DIBELS, AIMSweb, and PALS. The first crucial phonemic awareness skill that needs to be assessed is a student's ability to isolate the beginning sounds of words. Remember that phonemic awareness is all auditory. There is no reading involved. DIBELS Next First Sound Fluency, FSF, assesses a student's ability to recognize the first sound in a word. Research shows that students may be assessed in their primary language, and this skill in any language will determine the ease with which they will learn to read in English. Students not meeting benchmarks in first sound fluency will need direct and explicit instruction in order to keep on track. The second phonemic awareness skill to assess is a student's ability to segment a word into phonemes. Again, DIBELS and AIMSweb have phonemic segmentation fluency, PSF, subtests for this purpose. This subtest is administered to general education students in kindergarten and first grade. Struggling students should also be assessed in second and third grade with the PALS letter sound subtest. This assessment may also be used at any grade level in special education. The third phonemic awareness skill to assess is blending. Blending is assessed in general education first grade, second, and third grade for struggling general education students, and any level for special education students. PALS has a blending assessment for this purpose. After students have moved beyond phonemic awareness, there are many different ways to screen beginning reading or decoding skills in the primary grades or any grade for students in special education. You can assess students on individual letter-sound correspondences initially, then move into sounding out words. Nonsense words are often used so that students cannot memorize words or correctly guess. Some common screening assessments include PALS letter-sound correspondence test, AIMSweb Letter Sound Fluency Subtest, DIBELS Letter Naming Fluency, or LNF, DIBELS Reading Nonsense Words, NWF, or reading lists of high-frequency regular and exception words, including PALS Word Recognition, FRI, Dolch, and DIBELS Word Identification Fluency, or WIF. When a student is able to sound out words consistency, fluency may be assessed. Screening measures for fluency include DIBELS Next Oral Reading Fluency, or DORF, AIMSweb, and PALS. For screening fluency, students read 3 passages of the same difficulty level. The median, or numerically middle score, is noted as a baseline or beginning score. Vocabulary is not often assessed in students unless it is specifically related to curriculum or there is a question about a student's receptive or expressive language skills. When screening a student for vocabulary skills, norm-referenced vocabulary assessment should be used with careful attention being given to what type of vocabulary skills are being assessed, expressive or receptive. The last piece to the reading puzzle that students after grade 3 should be assessed on is reading comprehension. You cannot assess reading comprehension on any student that has weak decoding skills. This complex last piece of the reading puzzle should include comprehensive screening in all of the following areas: oral reading fluency, oral language, listening comprehension, literal and inferential comprehension, expository comprehension, and metacognitive skills. After grade 3 and up through grade 12, Mays and closed curriculum-based assessments may be used to assess reading comprehension. To accurately complete, students have to decode the text, apply background knowledge, and understand basic word order, vocabulary, and sentence meaning and context. Dibble's DAYS is one such screening measure. Up next, you're going to view CAP number 2, where progress monitoring tools will be discussed.